Have you ever played video games or known someone who has? You do stuff, you get experience, then you level up and you get more powers. What if charting in medicine were similar? There's different levels from novice to amateur to professional to master. A person at each level faces the same charting, but has different thoughts, beliefs, and stories that they tell themselves. It's not so hard. I don't have enough time. I have to bring all this work home. Regardless of whether you like video games, what if I told you that there was a program to take you from where you are toward being that charting master? I want you to know there is hope. Charting Mastery is my 6-week coaching program to help you master charting. It's for physicians who want to feel confident in their charting, ditch the overwhelm, and leave work at work. The first cohort will start later this summer 2022. So if you want to know when doors open for this or subsequent cohorts, join the waitlist today. You can find that at chartingmastery.net. And now for the rest of today's episode. Welcome to the MedEdWell podcast, empowering physicians to get work done at work and then be able to reflect and choose what is important for both their life and medical practice. I'm your host, Dr. Ryan Stegink, general pediatrician and life coach for physicians. Thank you so much for joining me here on episode 39 of the MedEdWell podcast. I so appreciate you showing up, for subscribing, and for listening to these episodes, engaging, and finding what your next step forward is to support your wellness as a physician. In episode 38, we talked about delegation, part of the 6-part series on workflow and charting optimizations. Today, we'll be talking about batching, about how doing things all together of a particular type can really help your efficiency. When I was growing up, I would make cookies with my mom. The snickerdoodles were some of my favorites. They were kind of sugar cookies rolled in cinnamon sugar. But we didn't make just one at a time. We'd mix all the ingredients together, make a bunch of dough, and after rolling in the sugar and scooping them out, we'd bake a tray or two at a time. So when you say a batch of cookies, it really comes down to you're doing a bunch of those, putting a bunch of those on a tray and baking them all at once. A batch. But it's not just for cooking. When batching is intentionally used in medicine, it can really help efficiency. And sure, there's some variability, but these are some tools to have in your tool belt as you're considering how you continue to move forward. So we'll talk about 5 different things, 4 areas, and why it matters. So the first area is looking at paperwork and some of the modules that we have to complete. These are separate things, but they're both some of those administrative tasks. Yes, you can delegate, particularly some of the paperwork, but by doing all of the paperwork together, maybe once a day, twice a day, maybe depending on how much paperwork you get or how urgent it is, maybe even a few times a week. But by sitting down and taking all the paperwork and doing it at once, I now sort the labs to review, forms to review, and just need a signature, or forms that I actually have to look something up. Another reason why it's helpful to batch is because the paperwork often takes over my whole desk, at least for a couple minutes, while I'm sorting and taking those next steps. And it also is helpful because I just find that getting those things completed off my plate just gives me a little bit more mental space. Moving from paperwork to modules, I often will try to knock them out in 1 or 2 sittings because then I don't have them hanging over my head. I almost missed one of the medical malpractice modules that I have to complete on an annual basis because I did 2 of the 5 and thought that I had done 3 of the 5 when I only needed 3, but almost missed the deadline. My clinical supervisor reached out and said, "Did you know you still have 1 left to do?" And I said, "Let me check." "Oh, thank you so much for letting me know." So I had been trying to batch for the other ones, but it's just important to stay on top of it. And if you can get things done, then you don't have to wonder, how much did I do? How much did I not? And what do I have left to do? An important caveat: this is separate from discussing the necessity of all the modules and paperwork. There are definitely too many modules and too much paperwork. And some of this involves advocating. We talked in episode 33 about advocating for yourself and for the system. It may be that you have to do some of that advocacy at that higher level in order to reduce the amount of modules, to streamline things, to help figure out better ways of processing the paperwork. But it's still helpful to think about, how do we take those things and make a change for ourselves? And how do we batch them to get them done so that they're off our plate, while at the same time still considering, how do we make this more manageable in the long term? So, number 2, speaking of things to reduce or streamline, can also be email. So, email can also be batched. It's a great communication tool until everyone hits the reply all. And you really didn't need to get that reply with, "I got it," or "Here's when I'm available." And no, it's about streamlining that, but also not checking it all the time. It may be helpful to check it just at certain times of day, maybe even just when you're at work. I took the work email off my mail app on my phone because I was just checking it too much and I didn't need to. Number 3, patient care can also be batched. We talked previously about going room to room, patient to patient, maybe not back to the workroom between every patient. Sometimes when I have siblings, I'll do all the histories, one after the other, and then examine the children, one after the other. Again, this might look different in your clinical practice, but these are tools, categories of thinking about things. So first, we had the paperwork and modules, some of those administrative tasks, about emailing, about patient care, but then we come to notes. You may think, why are we adding notes to this list about batching? Even if you go room to room, there will be times where there are still some notes left at the end of the day. And it's important when you get there that you don't mix notes, paperwork, and socializing. I still have done it many times myself, but sometimes sitting down for 20, 30 minutes, being focused and just going for it helps me get done faster. This is especially true when the medical record that I use is optimized for a larger screen on the desktops we have in our office, and bringing them home, not only is it on the work laptop and the screen is different, The connection may not be as strong, but it's just harder to stay in that mental space of, I'm going to get this done. Let's do this. And by batching, you can stay in the flow of going, let's get this note done, sign it, and you've taken care of that whole encounter. So again, tools in your tool belt for those situations where, you weren't able to get them all done as you went. It's about progress, not perfection. I'm there with you. So the 4 areas: paperwork and modules, looking at batching email and how often you check it, patient care and notes. But finally, why? Why does it matter? So you have to look at what your underlying priorities and what you want to accomplish, what those things are. If you want to get home sooner or bring less work home, maybe you need to take some different actions to get there. So with that in mind, what could you consider about batching? What thoughts could you think about batching that you could think today that might help you choose the next action that's right for you, that moves you towards these goals? I look forward to hearing from you. Send me an email, send me a message on Instagram, reach out and let me know how you took action. Thanks for listening to this episode, for subscribing, for sharing. I want to encourage you. You matter. Your wellness matters. It matters not just to you, but to family and friends, to your patients, to your community. This is so important that we continue to grow and to care for ourselves so that we can care for each other. Thanks so much for listening. Come back for the next episode. Have a great day. And now for our important disclaimer. Dr. Ryan Stegink is a practicing general pediatrician, but the MedEdWell podcast does not reflect the views, opinions, or belief of his employer nor his affiliated university. Additionally, the MedEdWell podcast is for educational and entertainment purposes only and should not be considered advice regarding financial, legal, student loan, medical, or any other specific topic. In such a case, you should seek consultation with a certified professional in that particular area. Again, thanks for joining us on the MedEdWell podcast, and have a great day.